So let's start off by defining what an opioid is. An opioid medication is essentially any medication that works on the morphine receptors in our body. Some people may be alarmed to learn that some of the drugs they're taking for their pain management actually fall in this category. We generally define opioid drugs as weak or strong medication preparations. The weaker ones include codeine phosphate, dihydrocodeine, and tramadol. The stronger morphine preparations include morphine as a tablet itself or as a liquid, oxycodone, buprenorphine, and fentanyl. The number of people using opioids in the United Kingdom at any one time is largely an unknown, but what we do know is that the prescribing trend over the last 10 years for these types of drugs for non-cancer pain has increased dramatically. And this is a particular problem as we're starting to learn that long-term use of these drugs cause real harm and problems for the majority of individuals. So generally speaking, opioids are prescribed for the management of pain of some sort. There are certain conditions where doctors might consider using opioid medications, but these are very rare, and these include the management of certain respiratory disorders or cardiovascular issues. In general, as I mentioned, opioids are prescribed for the management of pain, and this pain could be what we term acute pain, end-of-life or cancer pain, or for chronic long-term mechanical pain. So let's start off by defining a few of the terms in the question. Acute and chronic are terms often used by patients to try and define the severity of their symptoms. Medically, we use these terms to define time. So an acute episode or acute pain is pain that lasts up to about 3 months. Anything that lasts longer than 3 months we define as chronic. With regards to use of opioid medications, there's very good evidence for the use of these medications in an acute episode. So an example of that would be after trauma or a broken bone, for example, or after surgery. Interestingly, there's very little evidence that these drugs are helpful in chronic long-term pain management. But what we do know is that the use of these drugs in the long term can be extremely harmful indeed. Nobody truly understands how addiction occurs to a substance or a drug. We do know that patients bring with them certain behavioural characteristics that might predispose them to developing addiction. That includes known addiction to certain substances such as alcohol or smoking. Other elements are important, such as a background of anxiety or depression, and these traits do predispose an individual to developing addiction to drugs such as opioids. We also know that complex neurological changes occur, such as an increase in the development of certain neurotransmitters or changes in the brain circuitry that predisposes an individual to development of addiction. The important message here is that even if you don't believe that you have these behavioural traits, these neurological changes means that everybody is at risk of developing addiction when placed in front of these drugs for a long period of time. So the fact that an individual has chronic pain, so that's pain lasting more than 3 months, means that there's no simple mechanical fix for their pain. Often patients bring baggage with them, so their thoughts about their pain changes, their behaviour changes, the way they walk or partake in activities all change. So when dealing with an individual with chronic pain, we look at all of these elements to try and help that patient manage their pain better. So the kind of tools that we use to help patients with chronic pain include psychological strategies, physical therapies, looking at alternative drugs, especially discussing around the subject of opioids. For a group of patients, injections may also form a part of their management strategy. The first thing is to identify that you are a high-risk individual for addiction. And that can be simply you've noticed you've been taking these drugs for a long period of time, or you've changed your behaviour around the use of these drugs. For example, you start to become anxious about going away on holiday or making sure you have enough tablets. The good news is that for the majority of people, a slow weaning program is enough to remove yourself from these drugs very safely. For a very small percentage of people, we may need to bring in additional help to try and withdraw from these medications without the development of withdrawal side effects, and that may even require the use of substitution drugs to help bring you off these medications safely.